The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode. Hello, everyone. We have a really awesome guest here today, Dr. Glenn Vo. I'm so happy that you're here. We just finished up recording for your podcast, actually. So depending which way you're coming from, make sure you listen to that as well if you don't get enough of us from this one episode. So could you just introduce yourself a bit? Tell us where you're located, where you're practicing.
Well, I'm Dr. Glenn Vo. I am based out of Dallas, Texas. It's actually where I went to dental school. I went to dental school at Baylor College of Dentistry. It's now Texas A&M College of Dentistry, unfortunately, for people who are UT people, unfortunately. But actually, that's actually where I met my wife. My wife was a class ahead of me. And it actually worked out really good because I got all her old tests. I got all her notes. It was awesome. But just to let you guys know, she's got the better end of the deal because at her practice, I see all the patients that you can't lean back at all the patients who can't open their mouth, all the patients who have gag reflex, all those patients, they're now on my schedule, and she has like the best patients on her schedule. So with that being said, we have a practice up at Denton, Texas, which is outside of Dallas, about 30 minutes. It's a college town. And we opened it in 2009 as a startup practice and still continue to own the practice to this day. So much like Haley, I'm the type of person who was like, I got to get myself into other things as well. And that's why I created the Nifty Thrifty Dentist community, where we help people save money in their dental practice, but also really it's a community for us to level up into just to connect with each other. And so that's pretty much it. I do have two kids, 14-year-old Kylie, who is a freshman in high school. Source of anxiety right now. I'm like so stressed out about her being in high school. She seems to love it, but I'm really stressed out about that. And then my 11-year-old son, who just started middle school, not so much stressed out with him. I'm more stressed out with my daughter in the high school. But that's our life. And again, just love being in dentistry and so happy to be on here on your podcast.
I'm excited to dive a little bit more into your backstory and everything. I'm curious off the bat with having a practice with your wife. Before you met your wife, did you think you would be in a practice with another dentist, or did you think it would be just you?
I definitely didn't think I was going to be married to another dentist. You see someone all the time and I'm just thinking to myself, like, I don't want to talk about dentistry. I want to talk about something else. I never thought that would happen, much less actually practicing with my wife. But I'll tell you what, it's been amazing. It's been amazing because, who can you trust? Who can you than your spouse, right? Like, so it's like someone there who understands what I'm going through, but also I can trust with the practice. And, look, I mean, people are always worried about like, well, do you guys butt heads and whatnot? If your practice is performing at a high level, if your team makes sure you're busy, theoretically, you don't even have time to argue with anybody, right? You don't have time to argue with your spouse. What's cool, though, is that during lunch, we can have lunch together. And then now with kids, like one of us can leave and pick up the kids and whatnot. And generally that's me. So she's more chair side now with the Nifty Thrifty Dentist community, my podcast, speaking and whatnot. I'm not as chair side, but that was kind of like my plan, was to kind of step away from chair side. She absolutely loves dentistry. That's been her dream job ever since she was a little girl. And so I don't think that she'll ever truly get away from being chair side until she's forced to, right? So she's going to do it for as long as she can.
And how did you, throughout the years, set the hours that you were both practicing? Were you there all the time together? Did you alternate so you could stay open longer? And then now that you have kids, how has that changed?
That is such a great question. And for those who are like listening and watching right now, we all go through different seasons in life, right? So before we had kids, we were in a certain season where we wanted to establish ourselves financially. We wanted to pay our student loans. We wanted to do all those things. And so we actually worked a lot more during that season. And once we had kids, that started to, we started to cut back a little bit Susan, my wife, she started cutting back a little bit because she wanted to be there with our kids more often. And now that the kids are a little older, she's actually kind of gone into the practice a little bit more, and she's kind of structured. And I kind of like step back because I take all our kids to our their activities and whatnot. And so, we adjust our schedule to our life schedule. And one of us, depending on who it is, we kind of like make that decision like, okay, we want you to be more involved in these things, and we will do that in our practice. And so it's more of like a collaborative effort. My wife loves being a dentist. She could never be a stay-at-home mom, and nor would I want her to. Like, I want her to do whatever makes her happy. She worked really hard to get her dental degree, much like all of us. And so she loves being a dentist, and I'm okay taking some of that time away and spending time with the kids. So, my answer is that, understand what season of life you're in and take advantage of that season. So again, if you don't have kids, that's the season of hustle, right? You need to hustle, build that foundation so that when you do have kids, you're able to spend time with them and do so in a way that's responsible, but also in a way that you don't feel guilty.
Yeah, I love that. And similarly, I'm in that early stage of life where I don't have kids yet and kind of planning our futures. And it makes me wonder, as much as you're comfortable sharing, two dentists is double the debt, double the everything.
Yeah.
So what was that like in those early stages, figuring out your financial goals, and how were you able to get to a place where you guys were financially successful and comfortable?
So look, my Facebook community is called Nifty Thrifty Dentists, right? My podcast is called Nifty Thrifty Dentists, right? So I definitely practice what I preach. And when people ask, like, what does Nifty Thrifty mean? So nifty is like skillful. Thrifty is obviously trying to be, conscious of costs and your resources. So really, when you put the two things together, it's really about being smart about what really matters. And what I mean by that is, when you get out of school, the first thing you want to do is you want to get that nice car. You want to live it up, right? Like, you worked really hard. You deserve it, right? And that's what we tell ourselves. Like, I deserve this. I worked my butt off. And I'm going to tell you something that you might not like, and that is, you don't deserve it. You don't deserve anything. You don't deserve anything that you haven't accomplished, right? And so there's a thing called the rite of passage. The rite of passage is you owe a bunch of debt. You got to get yourself out of debt. Can you wait around and hope that the next president's going to basically wipe your debt free? You could hope, but it might not happen. There's so many people ahead of you that probably need it a lot more than you do. So what I mean by that is, be fiscally responsible. I'm not saying you can't have fun. Please take a vacation. Please do that, because if you're all work and no fun, you're going to burn out so fast. But maybe that Bentley that you've been wishing for, maybe that can wait a little bit, because again, you have to set yourself up to be successful in the future. If you plan on having kids, if you plan on spending time with those kids, you have to set yourself up for success so that if you don't have that debt on there, you can use that money that you were paying your loans down to invest in your kids, to take those vacations, to do the things that are really important, to also spend time with your spouse and spend money on your spouse as well. So again, the main thing is that you have to practice a little bit of delayed gratification. So many doctors, even doctors who are established, they get themselves in trouble. That's because they're keeping up with the Joneses. They're keeping up with other people. They feel like they have to prove to everyone that I'm this dentist and I have this certain lifestyle. That is the quickest way to burn yourself out, because if you get into debt, you'll get into a hole that's so hard to get out of. So my advice, just like what we did, we were very conservative with our expenses, and we put our money back into the practice. We try to pay off our practice loan as quickly as possible, our loans as quickly as possible. We had some time to have fun. We did budget for that, but any really big expense, we didn't partake in that until we actually got into not successful, but like a stable phase. So we didn't open our practice until about 2 to 3 years outside of graduation. We worked, we paid our loans back, and one of us spent most of the time, and that was my wife in the beginning. She spent most of the time in the practice, helped build it up. And I kept working as an associate and kept coming back. So my advice to everyone, Make sure you keep your day job at your associate practice, work it at your own practice. And you're not going to like what I'm going to say, but during that phase of life, I worked like 6 days a week. It was insane. But now that I look back, it's like that was the only way I can maintain my income and also grow the practice, because everything we made in our practice, we reinvested back in our practice.
I'd love to know more about the startup process then too. With being an associate, did you go like 30 minutes one way for the associateship and then 30 minutes north was the office? Did you have to be kind of spread out, or was your doctors you were working with at the associateship fine that you were opening up another office?
Yeah, no, that's such a good question. So I'm gonna start with how did I find my location? Because everyone's like, where do I go? And I'll tell you what, if you are in a dental society, if you have any mentors, the first people I would ask are those people. So I remember I was in the Dallas County Dental Society, and I just kind of went around and said, hey, if you had to do it all over again, where would you open your practice? And they're like, we definitely wouldn't open in Dallas. We would definitely go out to these outskirts and whatnot. So I listened. So I took a list down. Now, I didn't ask the supply rep. I didn't ask the broker, right? I asked other dentists. Okay. Now, I'm not saying all brokers and all supply reps are the same. Like they don't care where you go. They just want to make a buck. I'm not saying that. I am saying that there is a decent amount of them. They don't care where you open. They just want you to buy from them. So I asked other dentists, I was like, where would you go now if you were in my shoes? I took that list down. Then I looked at the demographics in that area, and I looked at all the other dentists. I looked at where they were in their careers. Was there a bunch of other young dentists, or are there a bunch of older dentists who are at different phase in their life? So we picked Denton, Texas, because Denton is a college town, but I knew that the population was slowly moving out there. I also looked at all the dentists. They were a lot older than I was. So I knew two things were going to happen. Number one, they're going to cut down, much like where I am right now. They're going to cut down, and they were possibly going to sell to someone else. Now, why is that important? Because then I knew, well, if they're cutting down, that means they're probably not open on Fridays. They're probably not even open on Saturdays. Their hours are probably not later. So that's where a young person like I can basically make an impact, right? And if they decide to sell it to someone else, well, then that person will have to start all over again. Because again, those patients are going to see them as like, okay, that's not my same dentist and whatnot. So they gave me an opportunity. So we settled on Denton. Now, as far as my associate goes, I always believe in being upfront with everyone. And I would just encourage everyone, if you're thinking about opening a practice, be upfront with the person you're working with. If they are someone who really cares about you, they'll support you. There's no reason to hide anything. And I think it makes things really awkward. But also, when I told the doctor I was working for, he had multiple locations. And actually, he was happy for me. He actually then started mentoring me and saying, hey, these are the things you should do in your practice. Believe it or not, dentists out there, we want each other to succeed. Even the doctor that you're working for. So if you are upfront, you're going to get the opportunity to possibly learn from them as well. Don't keep it a secret. So they knew that eventually I would go over the practice. So it took us about, I would say 3 months to be profitable. And again, people are like, well, that's amazing. Well, that's because I didn't take any money out of it. Like I reinvested everything. Like all the money we made in there went back in that practice. That's why I suggest having another job. And then I would say about the 6-month mark, I was able to get into the practice as well. My wife was working full time. I was able to pick a couple of days. And by the time the first year, we celebrated our first year anniversary, we were both there. So you don't have to do it my way, but my way is what actually helped me. Again, just understand that you're in a season of life where you're going to hustle. You're going to be working your butt off. Okay. The hard work doesn't stop when you graduate. When you start to practice, that's when the real hard work starts. So just keep that in mind that you're going to be working your butt off.
Dr. Glenn Vo and Nifty Thrifty Dentists is all about leveling the playing field between solo practitioners and corporate dentistry, and making the same discounts that large practices receive available to all of us. That makes Smart Start from ADEC a perfect fit. Smart Start is a special savings program that helps first-time practice owners with up to 25% off retail pricing on ADEC equipment, furniture, and clinical purchases for 2 years. It also includes additional discounts and complimentary services from ADEC partners. Nifty, right? So, if you're considering your own practice, check out the link in my show notes for resources.
Throughout that process, I would imagine there's so much going on in your head when you're early in the startup, like so much doubt, maybe imposter syndrome, just I'm doing all this work, these dollars come in and then there's nothing left. Or like you're choosing to reinvest back in the business, but it probably hurts a little bit in a way too. Like how did you put your mind in the right spot to view that as stepping stones to where you are now? Because you didn't know that you'd end up where you are now. You just hoped and you were working. But like how, for someone in that stage that might be really struggling, what advice would you have?
Wow, that is such a good question. And that is something that I think every dentist will face this no matter. I think that you're always going to have some level of imposter syndrome no matter what. And that's only because we care so much. If you care a lot about other people, about doing the right thing, you will suffer from imposter syndrome. Why? Because you want to make sure that you take care of everyone in your life and also your patients to the best of your ability. So you're always going to have that self-doubt because you're wondering like, can I do more? Can I do more for this person? So just understand that imposter syndrome really has nothing to do with your insecurities. It has everything to do with the fact that you care so much. If you didn't care about these other the patients, if you didn't care about your family, then you wouldn't have imposter syndrome. You wouldn't care. You would just be like, whatever, But because you care, you're going to have that. So I just want to make sure that everyone understands that. But again, the biggest thing that I do right now that helps me a lot to this day is I do a gratitude exercise. So literally, like I sit there and before my day starts, and it could be before you start seeing patients, you look at and you say, look at all this that I've accomplished, like, and look what I have right now, and look where I was before. Maybe at one time when I was when you were a pre-dental student, the only thing you cared about was, I want to get into dental school. And then when you're in dental school, you're like, the only thing I want is I just want to pass and be a dentist, right? And then when you're an associate dentist, you're like, all I want to think about is I just want to own a practice. Reminding ourselves of all the things that we went through and where we were before is a great way to really rationalize where you're at in life, right? Could things always be better? Absolutely. But man, look at all the stuff you did. And so when I wasn't making as much as I wanted to, my wife and I would sit like, man, but you know what? We got to practice, right? We're happy and we got, I don't have to eat pizza every night. I don't have to eat ramen noodles anymore. And so I think a lot of times when we elevate in our lives, we feel like we want so much more when really at one point in time, all we wanted was just be able to go out to eat once in a while, right? Like, I mean, at one time you're probably thinking like, I just want to go eat Chipotle, right? And like use my ATM card and know that when I take money out of the ATM, I have more than like 10 cents in there, I think we just have to go back there. And so that is something that was really helpful for us, but also looking at the progress you make. Like some people, again, this is like the one thing that people dentists are really bad about is like we like to compare ourselves to others and we like to beat ourselves down. Like we just like to beat ourselves down. And the thing is at the end of the day, as long as you're improving, that's all that matters. Doesn't matter what Glenn Vo does. Doesn't matter what Haley Schultz does. Doesn't matter what we do. It doesn't matter what you do. And if you keep on comparing yourselves to others, that's the quickest way to burn out and depression and whatnot. Look, everyone has their own journey. As long as you're getting better every day, that's all that matters.
I love that you ended on that too, because I mean, with what we do with putting our lives out there and sharing our experiences and sharing advice and bringing other people on to share their advice, I never want it to come off in a way where you have to do IZ and you will be this person living their life. Like it's never like that. It's more of a motivational and what can you take from that and use it in your own way. I always wonder and hope that people understand that there's no secret formula to get what you want. It's going to be different for every person. And a lot of it comes down to the hard work and the things that people don't show, don't talk about till they're on the other side of things. And they might not remember exactly what it felt like in that moment.
Yeah, no, absolutely. And I think it's so, I mean, honestly, podcasts like yours and, Facebook Lives, like what Dr. Alan Stern does, and communities like I have in Nifty Thrifty, it's so important because a lot of times, before all social media and all these access to meet other people, I mean, dentists were really just kind of like by themselves, and they only saw another dentist at trade shows or at, study clubs and whatnot. And the rest of the week, they were kind of alone. I'm lucky that my wife is a dentist and she kind of understands, and I understand what she's going through. But for dentists who don't have a dental spouse or someone who doesn't understand what you're going through, it can be really lonely, right? And so, especially with now it's mental health is taken more seriously, but the dentists that came before us, I really have a lot of empathy for them because they were practicing at a time where that wasn't really taken seriously and they were really alone. And so for those who are watching and listening right now, if you're from that generation, hey, at least things are better and there's so many different avenues. But for the younger dentists, like, take these things very seriously. And that is like, you do you. Like, you have nothing to prove. You don't have to. There's going to be people out there that have a lot of success, and that's great for them, and that's good for us to get inspired by. But that's not your journey, right? Again, just that's not your journey. There's so many great things that you're going to do. And there's no reason to beat yourself down, because as dentists, we are good. Like, we are experts at beating ourselves down and tearing each other down, which, again, hopefully we're moving in a direction where that's not more common. Because, again, like, you put a prep on there, a million dentists would jump in like, well, you shouldn't have finished that with that finish line. And hey, what are you doing there and whatnot? There's too many of that in the world right now for us to do that to each other.
I totally agree and feel like it's so easy to compare yourself. But what I try to do to work through that is comparing myself against myself, which, again, you want to, obviously within reason, not beat yourself up too much. But it's easy to look on Instagram and see all these amazing work and say, oh, like, how could I pick one thing from that and try to execute that next time? Comparing your own work and seeing how you could improve as an individual clinician, and more so measuring yourself against yourself, you're going to find actual improvement and more satisfaction than aspiring to something that could be very curated, given that it's social media and everything. You really don't even know how those things came to be, and you're wanting it in every single scenario in your chair, when we all know that some things are just very complicated and they're not as beautiful as you might like. But again, like, just asking yourself, like, how could I have done that better? How could I have made that experience better for the patient? And just little by little trying to improve. And for me, that's so much of what I'm doing right now, being fresh out of school, is just little by little trying to make things better and trying not to be too critical, while also being critical enough that I can improve. And yeah, it's a balance for sure.
Yeah, absolutely. I mean, again, and that's just life in general too, right? I mean, you see all these people are doing these amazing things, and that's sometimes I have to remind myself as well. It's like, look, I mean, on social media, like, we have fun at these locations and we want to celebrate it, right? It has nothing to do with like, I'm just trying to, hey, look at me. I mean, for the most part, depending on who your circle is, right? For the most part, people aren't posting things because they're trying to brag, but really they're just so excited about it, right? And again, that's not normal life. Like, not everyone is flying to Portugal like every weekend to, eat in Lisbon and stuff like that, or they're not going to the Caribbean and sitting on a beach. So it's like, that's just like once in a while. It's not every day, but sometimes we have to remind ourselves, right? The difference between a small moment in time and actual day-to-day life.
Mm-hmm. And as I was talking about kind of clinical things and improvement as new grads. Is there anything that you did early on in your career to level up on the clinical sides of things? Did you invest heavily in actual CE? Did you just talk to mentor doctors? Did you watch free things? I know it was also a little bit different of a time
Yeah.
back then too. So
Yeah.
what advice would you have for people looking to level up their clinical skills specifically?
So what I would say early in your career and early in my career, I made sure I did as many procedures as possible. So for me, I had like there's this fork in the road when I graduated. I could be like an associate in a private practice, or I can work for a corporate group. So 50% of my classmates went the associate route, and I went into other 50% went to the corporate route. Now, my situation is a little bit different. I actually had some financial obligations that my family needed met. Like I needed to help out my family, so I actually needed to make as much money as possible to help them out. But also, I wanted to be in an environment where I saw a ton of patients. I wanted to see everything. Now, did I work my butt off? Yes. But did I see a lot of stuff? Yes. Did I see some stuff that shouldn't be ever be done in a dental practice? Yes. So I learned all those things, and really during that experience, I told myself, okay, I'm gonna practice a certain way. That's how I'm gonna practice. There's certain things I won't do, but there's certain things that I took from it. Like again, I got a lot of experience like in oral surgery. I was working in a kind of like a lower income area. So I was doing a lot of like emergency and surgery, and I got really good at that. So for those who are thinking about like, where can I invest? Well, here's the thing. Make sure if you want to get good at something, whatever it is, get in a practice that does a lot of that. For me, I wanted to be really good at surgery. So I was in an area where there was emergencies all the time. I was taking out teeth all the time. The second thing is that there's a myth out there. And again, I had a good friend of mine who also has a really big social media group. I kind of went back and forth with him in his group. And he was like, well, you need to invest a lot of money to get better. And I said, that's true, but you don't have to. That's not the only way. And they're like, well, it's going to pay off. I was like, I get it, but you don't have to do that. And again, there's a lot of free resources. There's mission trips, right? A lot of the things I learned surgery wise, I went on a mission trip. Giving back to the community is something that's really near and dear to me. And I love going on mission trips. Well, when you're on mission trips, you're doing a lot of surgery. And guess who's also there? Other experienced dentists. You can learn side by side, learning from them to level up your skills while also giving back to your community. I think also doing some kind of mission trip, whether it's overseas or in the States, I think everyone should do that at least once a year. I think you need to be reminded why you became a dentist. You didn't become a dentist because it was all about making money. It's all about making a difference. And I think it's good for everyone there. So mission trips, I want to give one quick resource. Arrowhead Dental Lab has a new grad program. I mean, I think it's like $5,000, but it's like you get like so much. I mean, it's worth like $30,000. It's like $5,000. You learn like full mouth rehab, you learn cosmetics, you learn occlusion, you learn so many different things. It is by far the best value ever. So again, if you can't afford anything, take the Arrowhead Dental Lab new grad continuum. And it's $30,000 worth of CE, and you only pay $5,000 for it. It's like you take like 5 courses in that continuum. It is by far like the best value. So I highly recommend that.
I've heard that recommended before too. So that just doubles down on it being
Yeah.
something worthwhile. And thank you for also the other insight that you gave on just how to grow your skills without necessarily putting in dollars, just by being ambitious at your office and trying to get as many procedures in as you can. And as for mission trips, how did you go about finding the ones that you went on? Was it through just other dentists in your area, or how did you find those?
Yeah, so it's actually through other dentists. I mean, I reached out. The mission trip I went to was in Guatemala, and it was a long time ago. And actually, probably one of like the more memorable dental experiences I've ever had. I've been telling myself, I need to go back, and life happens and whatnot. But the one I went on, it was a private mission trip that was organized by a Christian organization. And so not only dentists, but physicians went down there as well. So it was like they were doing like their checkups and whatnot. And we had an emergency dental clinic there. But one of the most gratifying things that I experienced there, it was just the relationships I made with a lot of these kids. And most of the patients, believe it or not, most of the patients at these mission trips are kids. And they've never been to a dentist before. And they're in pain or they're doing all these things. And I remember while I was taking a break and we were doing just a full day of seeing patients. I think I saw like 30 patients that day. It was hot. I was just outside, just taking a break. And there was this kid pushing this cart with it's like this like Latin American chip. It's called chicharrones, right? So it's like Latin American chips. And he was selling these bags. And I asked the kid, I was like, why aren't you in school? Like, what are you doing? I asked like translator to translate. I was like, what are you doing? He's like, I got to sell these bags of chips before I can go play soccer with my friends. I was like, well, how much is this bag of chips? And I think it was like a quarter or something. And I was like, you know what? I'm going to buy all your chips. So I think it cost me like $25 or something, nothing ridiculous, So I bought all his chips and I gave it to all the kids in the clinic. And then we took a picture, but that picture of me and that kid and all his friends and all the kids in the clinic came by. That was like one of like the just most memorable things that I ever been a part of. And so the mission trips, I highly recommend, whether you have an experience like that, or maybe it's an experience you make with a patient, helping them get out of pain. You not only will level up your skills, because you will learn how to take out like teeth with 2 instruments. Like literally that's all you have, right? Everyone's sharing instruments and you only have like, you'll take out a molar with like a 151 or something like that. Like, how did you do that? You make do because that's all you have. Your skill level will go up, but you know what's going to change is what's inside of you. Like you will come back as such a much better dentist because you see what people are going through, but also you'll have so much more empathy and that'll make you a better dentist. So I know I kind of gave you a long answer there. It's something that I'm very passionate about, going on mission trips, but also stateside, the Mission of Mercy. I don't know if they have, it's not everywhere, but there's different states where they do it. Texas does it, Texas Mission of Mercy. You can fly and see a different part of the country. You don't even have to leave the country, and you can do these mission trips and you can learn new procedures and you can help these people and you can make some really meaningful relationships. So, yeah.
Yeah, we have a Mission of Mercy in Michigan as well. I think most states do. So definitely something for people to look into. And that was one of my favorite experiences as a pre-dental student even. You can go and volunteer there and dental assist or check in patients, or even one of my roles was literally just like a patient engager. I just like walked around in the lines and like talked to them so they weren't bored, or like got people waters if they were feeling lightheaded, because it's usually in the summer here. And that was so cool because I could just hear people's stories. How did you get here? And when was the last time you were able to get dental care and things like that? So it was a very, very great opportunity to be involved in, even as a pre-dental student, when I wasn't able to necessarily directly provide these people what they came there for. It was just very, very cool. So I definitely recommend Mission of Mercy as well. So before we wrap up, do you have any kind of closing thoughts or final advice to give people?
Yeah, no, gosh, I can talk all day, but I'm not going to do that. I know we're both busy and whatnot, but something that you brought up when you were on my podcast was the communication skills, right? Like how you were saying, like, that's one thing that you feel like needs to be, trained and looked over and taught to dental students. And I would tell anybody who's watching this right now, whether you're young dentists, older dentists, always continue to level up your communication skills. Always. And again, something as simple as, why don't you just listen for a few minutes first before you say anything? That's like my communication tip. If you're going to ask me, like, what's a good tip? Listen first and really listen and ask thoughtful questions to get more clarity. If your focus is to get more clarity and understand the other person, what they're trying to say, that is like the first big step towards becoming a better communicator. You're going to face that with not only your patients, but your team members. Your team members, how they perform at your practice, how they react to different things. There's a story behind that. So before you get into what you know, before you try to solve any problems, find out what the story is first, because the answer lies into the story. That is something that not only will help you as a clinician, honestly, it'll help you with your relationships as well. As dentists, we're tasked with knowing the answer. Hey, you have that sensitivity with that particular tooth because your filling's high. You have that swelling because you have an abscess from this infection, from this cavity. We're tasked with that, so we're used to just blurting out the answer. Take that. That's good for certain things clinical wise, but when it comes to your relationships and talking to people, that's actually not a good way to communicate. Get clarity. Do a soap, you take soap notes, for a tooth, right? Do some soap notes, right? Before you actually give your 2 cents, and I think if you do that, your level of relationships with their patient and with your team and also your personal relationships will go up. That's my advice.
That's awesome. It's so good for people to think about, especially because most of my audience is earlier in their career. So the sooner that they can start trying to work on those skills, the better, and resources that they can seek out. Speaking of resources, how can people follow you, follow your pages, be engaged? And if they have any questions, where should they reach out to you?
Yeah, absolutely. Well, first, I'd love for everyone to be part of our community, Nifty Thrifty Dentists. It's on Facebook. You can join there. The Nifty Thrifty Dentist website. Our podcast is on there as well. And it's on most of the other, podcasting platforms. I have a lot of cool guests like yours truly right here, Dr. Haley right here. She's been on our podcast too. But, and of course, I'm on Instagram and Facebook. I am on Facebook more often. Glenn Vo, just shoot me a message. I try my best to respond to everyone in a timely manner. But I will respond. But again, I'd love to meet people and hear your story and see where I could be a resource. I grew my business, my dental practice, all my other businesses by relationships. Believe it or not, we're not in the teeth business. We're actually in the relationship business, right? There's real people attached to those teeth. And so I'd love to reach out to all of you guys. So send me a message and happy to connect.
Awesome. Thank you so much for your time today.
Thank you, everyone.